Okay, يلا بينا.
Okay.
Hello, good evening. Let me introduce myself. My name is Dr. Mina Maha. I'm one of the treating physicians today. May I know your name, please?
Well, my name is Sam.
Well, nice to meet you, Sam. How can I help you today, Sam?
Well, doctor, I have been on a 3-week trip to a tropical
Uh-huh.
area and
Yeah.
returned 3 days ago with
Uh-huh.
symptoms flu-like. And
Yeah.
some of my friends told me that it may be malarial
Yeah.
infections as I was bitten by a lot of mosquitoes in this tropical area.
Okay. Well, Sam, I'm so sorry to hear that. Must be very worrying to you. Now, before we proceed, I'd like to find out more about these symptoms. Can you please tell me more about these symptoms?
Yes, doctor. It's a good question.
Mhm.
There's
Yeah.
slight, there's slight temperature, headaches,
Yeah.
joint aches, but the good thing is that there is no rash,
Yeah. I see.
only for a few
Well,
days,
okay.
and
Well,
the condition get worse by the time.
okay. Well, thank you for sharing such information with me, Sam. Now, I'd like to ask you about your uh, exposure to mosquito. You mentioned that you've been visiting tropical countries and you were exposed to multiple mosquito insect bites. Am I correct?
Well, doctor, you are right.
Okay, very good. Well, based on your symptoms, I believe that you may be suffering from a non-specific viral disease. It's an infection that caused by viruses. There is possibility of malaria and dengue fever, but I believe for now we can consider the symptoms non-specific viral disease. And I'd like to reassure you that these symptoms are completely manageable and they are very common. It's nothing to worry about. For now, we're gonna run some blood tests and follow you up in the general practice with your GP. How does that sound as a plan?
Well, doctor, it's a good thing. It's
Yeah,
more helpful for me, but
yeah,
I have no time to stay here in the emergency room. I'd like to go back to my work and home. So as I am so busy
yes,
to stay
yes.
in this room.
Well, the good news, Sam, is that you don't have to stay here. There's no reason for admission. I believe these symptoms are controllable and there's no risk of any danger to you or to your health. Uh, but you have to monitor your blood pressure frequently for uh, temperature. If you have any fever, you should return back or contact your general practitioner. But now I'd like to emphasize that it's important to exclude other diagnoses that can be done by uh, performing some basic investigations, blood workup, and some investigations. If this is okay with you,
Yes, yes, doctor, it's okay.
very good, very good. Well, I'm glad that you agreed to this. Um, Now, I'm going to ask a nurse to draw some blood for a blood workup and perform an ECG to check your heart. Do you have any questions so far?
Yes, doctor. Is
Sure.
that will take time?
No, it won't take time, just few minutes, and it won't even hurt. Don't worry about any of these things.
Thank you, doctor.
Okay, very good. So to recap, you came here today with flu-like symptoms. You mentioned history of visiting some tropical country, and I believe your symptoms are due to non-specific viral infection. We're going to perform some investigations, and we're going to follow you up with your GB. We're going to send your workup, blood workup to your GB, and he will follow you up. Uh, can I help you with anything else?
Thank you, doctor.
Okay, very good. Here is my contact number. You can contact me if you have any new symptoms. If you developed high fever or any signs of dehydration, please present yourself to the ER and have a good day, sir.
Well, doctor, but I have really slight temperatures and I have really fevers.
Well, your temperature is just a mild fever and it's nothing to worry about. Uh, uh, I was mentioning that if you developed a temperature of more than 40 degrees Celsius, you could present here and we're gonna take good care of you.
More than 40 degree, it means that I will
Yeah,
get melted.
okay. Yes, I don't mind if you melt.
حلو.
عكيت أنا عكيت خالص.
لا ايه العك؟ زي الفل.
مش عارف،
ايه اللي
حسيت
ناقص؟
أولا present yourself دي كأنك أنت
انت
إيه.
فرقته. It's a good questions. You are, I am happy. Thank you for sharing your information. I am glad. I am.
خليه يا عم نظبط العيان، دلع العيان.
حلو يا عم. حلو جدا. حلو جدا. ما عنديش تعليق بصراحة.
حلوة، حلوة التون كده.
كويس. كويس.
مش عارف ليه حاسس إن عايز أنام، بس أنا مش هنام دلوقتي.
ما اخري عاملة معايا الصح. ايه طيب.
مش عارف، ممكن نعمل كارد تاني. مش عارف هتنام ولا هتقعد ولا إيه.
انام بصراحة. هريح شوية مع
إيه؟
القلب. هريح شوية شوية دول، انا مش هصحى بس يعني عشان مناخيري مش قادر.
طب هقول لك حاجة، ممكن أسيبك رايح ساعة، إيه رأيك؟
تفضل صاحي وترن عليا ولا زي امبارح؟
لا، هظبط منبه حتى لو نمت هظبط. مفيش هيجي لي نوم دلوقتي أصلا. أنت
خلاص
هتنام؟
صح. صحيح. انا مش عايز
أنت
انام بس
هتنام؟
انا تعبان. أنا مش عايز انام بس انا تعبان.
وأنا تعبان برضه، مش عارف ليه جسمي متكسر كده. تقريبا الزاديتين اللي أنا خدته ده هو اللي بينام.
اسمه ايه؟
الزاديتين،
ده ايه ده؟
كيتوتيفين، ماست سيل ستابلايزر.
آه. في ازمة كاست وفي ليمفسيت وفي تليفاست وفي حاجات تانية كتير.
هو تقريبا هو اللي نايمني. عامة أحاول أنام، نمت متفكرش أنام لأن أنا لسه الساعة واحدة ولا منتش.
ساعة واحدة.
الساعة سوري 5. الساعة 5.
ماشي.
قشطة. يلا see you.